Hi, everybody. We're going to let everyone enter the Zoom webinar, and then we will get started. We'll give it a minute. All right. So let's get started. Welcome to our webinar. We are really excited to have everybody here. My name is Skylar Rossellini. I am with the National Health Law Program, and I am here with my colleagues, Alicia Emanuel, who's also with the National Health Law Program, and David Kane, who's with Western Center on Law and Poverty. So we're going to talk about unwinding, the big topic of the year right now. And so something that just want to point out, we will be distributing a recording of this presentation as well as the slides, so you'll have access to that after this presentation. And then what we do ask is to please put any questions into our Q&A function. This will help us make sure that questions are organized and that we get to them. And so we just want to minimize interactions in the chat because information often gets lost through there. So with that, this is our agenda for today. We're going to go over what's been going on during the public health emergency with Medi-Cal. And then we're going to go into specific Medi-Cal renewal rights for the unwinding period, as well as action steps that you can take right now and during the unwinding. And then we have some resources and guidance to help you consult with all the information we're giving you today. We'll have some time at the end for Q&A to ask additional questions. We can stay on, we'll be on until 3:15, so if you want to stick around for more questions, we'll be around a little longer for that. Next slide, please. All right, so what's been going on during this public health emergency? Next slide. So back in 2020, Medi-Cal renewals and most negative actions were paused under state and federal declarations and rules. Specifically, federal laws tied public health emergency to certain requirements, continuous coverage requirements that prohibited state Medicaid agencies like DHCS from taking most negative actions on people's Medi-Cal coverage during the public health emergency. There were a few exceptions for that if the beneficiary was deceased, if they left the state and no longer resided in California, or if they voluntarily canceled their coverage. But with those few exceptions, largely people, Medicaid agencies like DHCS have been prohibited from taking negative actions, terminating coverage, reducing coverage on people's coverage during the public health emergency. Now, the rules recently changed at the end of last year. Federal rules basically delinked the public health emergency from the continuous coverage requirement and put an end date on that continuous coverage requirement for March 31st of 2023. So right at the end of this month, we're arriving at the end of that. And under federal guidance, states have had the option within a certain period of time to begin initiating renewals. In California, DHCS has opted to begin initiating renewals April 1st of 2023. And they have an unwinding period of 12 months to initiate those renewals, an additional 2 months to complete the renewal. Next slide, please. So this is just a little overview of what we're looking at right now. So today we're at an all-time high with Medi-Cal enrollment. Approximately 15.4 million people are enrolled. That's about a 16+% increase in enrollment pre-pandemic. So this is really big. And based on the data that we have so far, there's an estimation of around 2 to 3 million people who are at risk of losing their coverage during this unwinding phase. So, the state has a big task at hand in processing renewals after, largely not processing cases for the past 3 years. Next slide, please. So this is the information we have on county operations today and what we've learned from the counties right now. Right now, they are asking for patience, for understanding during this unwinding period. They are facing some pretty significant staffing shortages, and there's a lot of high turnover. And because of those factors, and because of issues during the public health emergency with erroneous terminations and things like that have happened, there's been a lot of constant retraining, a lot of onboarding of new workers. It takes a lot of time, and counties throughout this public health emergency have been really not uniform in how they've been handling renewals. Some counties have been a positive change, meaning continuing people's Medi-Cal coverage. Some counties haven't touched renewal for these past 3 years. It's been really inconsistent, and we don't have a lot of information on the specifics of all of that. So with all of those factors, like I said, there's a big task at hand. There's a high volume of cases that counties are going to be processing. And so that's what we know with counties right now. Now, this is the bird's eye view of what this unwinding period looks like. The COVID protections end March 31st. Counties will start queuing up cases for June 2023 renewal month, starting April 1st. And then we'll start seeing the first negative action effective July 1st. Next slide, please. This is a little more specific view of the timeline here. So counties still have to comply with all federal and state requirements when processing renewals. None of that is changing. And at the start of the unwinding period, the general rule of thumb is that everybody gets fresh renewals. And we'll go over some of those exceptions, but that's the general rule of thumb here. So counties will queue up cases for the June 2023 renewal month starting April, doing the automatic renewal attempt with the ex parte process. We'll dig more into that so that they don't have to contact the beneficiary. If that's not successful, they're going to mail the renewal packets April 19th. And then the beneficiary will have the 60-day window to submit the renewal packets. In that 60-day window, counties still have to send the required renewal reminders, 2 of them in that window. And then counties are still required, if the beneficiary is determined ineligible for their June 2023 renewal month, they still have to send the 10-day notice of action informing beneficiaries that their Medi-Cal will be terminated. That means that July 1st will be the effective date. Next slide. So this is just a quick, example here. I won't spend too much time on this slide, but just to show you. So we have a beneficiary, Renato, whose renewal month is October. All right. So what does this mean for his renewal? This means that in August, the county will queue up his renewal and try to determine ex parte if he is eligible for Medi-Cal without having to contact him. They're going to do that in August. If that's not successful, they're going to mail him his renewal packet around August 19th. He's going to have that 60-day window to submit his renewal packet. The county is going to send him his 2 reminders in September, beginning of October, which is his renewal month, to remind him to submit his renewal packet. If at the end he is determined ineligible, they're going to send that notice of action to him by October 20th. He should receive it by October 20th to give him that 10-day notice of his Medi-Cal being terminated. November 1st is going to be his cutoff date. That's how that's going to work, just to give you an example there. Next slide, please. So what does this mean for, and sorry, just to reiterate, again, everybody gets to renew during the regular annual renewal month. So it's a fresh renewal. Whatever their renewal month was pre-pandemic is going to be their renewal month. That's the general rule of thumb here. And we're going to see those renewals occur and negative actions occur between June 2023 and May of 2024. That's the unwinding period window we're looking at. And there's a sequencing map that gives you a visual of each month and how those renewals will look for each month. So what does this mean for some other PHE related programs here? So you may know that California did have their temporary COVID-19 uninsured group program. This provided testing, test-related services, treatment services, vaccines related to COVID-19 for people who are uninsured or underinsured. Under federal law, this program expires in the month that the PHE expires. Since the public health emergency will expire on May 11th, that means that this program is going to sunset May 31st of 2023. What the state is going to be doing for this population is they're going to send a notice of termination to this population to let them know this is ending and how to apply for coverage with a single streamlined application so that they can get onto Medi-Cal or qualify for marketplace coverage with Cover California with financial assistance and APTCs. This population is also eligible for a special enrollment period as well, so that we make sure that we're catching this population. And just to reiterate, Medi-Cal still covers COVID testing, testing-related services, treatment, and vaccines. That has not changed. Next slide, please. So next, I want to get into our Medi-Cal renewal rights. So what is happening during this unwinding period? What are the rules here? Like I said, the rules haven't changed with regard to the federal and state requirements for renewing people's coverage. Everybody gets fresh renewals, and that's based on their original renewal month. We'll see that these renewals occur between June of this year and May of 2024. What this also means is that people's Medi-Cal coverage is protected until their renewal month during the unwinding period. Even if they sent in a renewal packet during the public health emergency, even if they reported a change in circumstance during the unwinding period, and we'll get into some of those intricacies in a bit, but the general rule of thumb is that they still get a fresh renewal. And let's see, people should still report their current information, even if they reported it before. So when the renewal month approaches, even if they reported it during the public health emergency, they should, and it hasn't changed since they last reported it, they should still report it. It's to make sure that their current information is on file with their county. That's some of the most important information we're trying to get out to folks. And Medi-Cal must stay active throughout each person's annual renewal process until the county gets to the renewal month and processes their eligibility. Folks can call the county, they can check their Benefits Cal account. For folks who are maybe unhoused or don't have a mailing address, they can do the same. They can still access the counties in all the ways that they're entitled to, in person, by mail, by phone. We'll talk more about some of that later on. So here's an example here. Again, our beneficiary, Renato, let's say in 2021, he switched jobs, he works at FedEx and earns a higher wage. He reported this info to the county in his renewal month in October of 2021. But then next year in 2022, he quits and he starts working at Amazon and he gets a lower wage. So he calls the county, he reports this info in April of 2022. In August of 2023, he receives his renewal packet since his renewal month is October. What should he report? Renato's still going to report his income, even if he reported it back in April of 2022. He's still going to report that income and make sure that it's correct on his renewal form when he submits that to the county. Now, just some things that I do want to cover with regards to renewals and some changes in circumstance. So as I said before, eligibility is still protected until first renewal. Some exceptions to that and the DHCS is still coming out with guidance on this, so we're still monitoring some of the guidance on this. But we do know that there's some exceptions with regard to CalFresh recertification. There's some instances where the Medi-Cal renewal packet that was sent but not returned, but the CalFresh recertification occurs. In those instances, that person may not receive a renewal packet for Medi-Cal if they complete the information during that CalFresh recertification. For folks who have SSI and have, therefore have SSI linked to Medi-Cal, they're not going to get a renewal as long as they're still qualifying for SSI. Their Medi-Cal coverage is going to continue. For positive changes in circumstance, that those folks may not receive a renewal for that. Counties, can process a positive change in circumstance without, sending that renewal. So there's some intricacies with that. Some other top renewal rights we just want to highlight to you and reiterate to you. Counties must still review beneficiaries for all categories of Medi-Cal eligibility before terminating. That was the rule before the pandemic. It still is. You have to make sure that there's not, some other Medi-Cal program they might qualify for to stay on Medi-Cal. Counties also have to use information they already have on file and have access to through e-data sources before requesting information from the beneficiary. And counties still have to send the pre-populated renewal form, the 2 reminder notices, and the final termination notice of action before terminating someone's Medi-Cal. And Medi-Cal must stay active until the counties complete the renewal processing. And with that, I will pass it on to David.
Thanks, Skylar, and hi, everybody. I'm going to keep it rolling here. So we're going to talk about contacts with beneficiaries. After 3 or more years of no renewals for realsies, how are people going to know that they got their renewals due or that they have the information and guidance they need to complete the process? Well, here's what's coming. A lot of contacts coming their way. First, there is a mailing that went out last month to everybody on Medi-Cal. It informs people, as you can see on this slide, that they need to update their contact information, report any household changes, answer all information requests, sign up for an online account, get ready to renew, is what this is all about. They sent another one of these. It looked almost exactly the same way back in early 2020. So this is a repeat one with some updated information, but people should be getting these soon. People on the breast and cervical cancer treatment program, BCCTP, got theirs even earlier in February, just FYI. What's good about this mailing is it also includes this listing of county phone numbers. Never before has the department been sending this in a mailing. We asked them to do it, and so now they are, which is great. So people can get the mailing, look up their county, call their county to report their updated contact information, which is the #1 thing to be doing right now. Also, things that are coming at people getting ready to renew. Renewal packets new this year during this whole period of the renewal restart are coming in yellow envelopes. It looks like this. It is a bright yellow envelope, not quite neon, not quite taxi cab, somewhere in the middle. It is a full page. It has 2 window openings where the sender address and the recipient address will appear. Everybody should be getting their renewal packet in this envelope, starting with the June renewal due month, all the way to May renewal due month 2024. Some people will not get it in the yellow envelope. Those are people that have their renewal packets manually sent to them by their county. Who are those people? Unfortunately, we don't know until the county has to manually send a renewal packet in certain situations. Also, the renewal forms that are coming at people in those yellow envelopes are new. They were revised in late 2020 and implemented in early 2021 to make them more readable, easier to fill out, clearer instructions. They're being sent in not all 19 threshold languages, although they are translated into all 19 threshold languages. People who select as their language Hindi, Meen, Japanese, Punjabi, Thai, and Ukrainian, those are not currently being sent, but there is a link where you can access it and provide it to people if they need them. We're pushing the counties to send them in those languages soon. And then also, as Skylar mentioned, there's a new reminder mailer that goes out midway through the renewal process. It goes out the second day of the person's renewal due month. It's a duplicate of the earlier reminder, but it's new and hopefully gives people another opportunity to see that they have to turn in their renewal. There also are things that counties are doing. Through text messages, they will be sending text messages to people during the renewal process. They send one when the Medi-Cal renewal is sent. They send one when the form is received back at the county. They send one when they receive a form that is incomplete because they want the person to contact them with the complete information. They send one when a form is processed, but it doesn't give you the determination. You have to wait for the mailed notice for that. And then they also send one when renewal information is not received right before the negative action would happen on the Medi-Cal. So that's another way, if somebody has their cell phone with the county, they should be getting those text messages. Also, if somebody signs up on benefitscal.com, which is the new website that soon will be used statewide, BenefitsCal will be sending emails and messages to users of that website, updating them about when their renewal is due and reminding them. So lots coming at people. This is some of it. This is what the new renewal form looks like, in case you missed it. It now has bigger text on the front page saying it's time to renew benefits for, lists the people, it lists clearer 1, 2, 3 steps, and it shows how people can submit their renewal by the internet, by mail, by phone, and in person, which are all their rights to do. Now some information about returned mail. There are some improvements that are being made when mail is returned, such as the county sending something and it comes back to them because the address they sent it to was bad. First, to avoid any returned mail, now counties are getting in-state forwarding addresses electronically through data files. There's also a renewal improvement throughout this process of the Medi-Cal renewal restart to use the National Change of Address database and use that to update the address for people. So that way the counties have the more current addresses. There's also a new flexibility where they're able to accept returned mail within state forwarding addresses and use that to contact somebody without going through other steps they used to have to go through. We're also seeing improvements in efforts to update addresses. Managed care plans are now doing the same thing when they get returned mail, noting when they have forwarding addresses and getting those over to the counties. Managed care plans are also able to report updated contact information that they receive from their members directly to the county to update the case file. Some people wonder, if I need to update my case information and my contact information, should I contact the county or should I contact my managed care plan? Maybe I can't reach the county, but I can reach my managed care plan. Well, when you want to report the update, it eventually needs to go to the county to make a difference. So it's best that you give it to the county. You can also give it to your managed care plan, and then they will send it to your county. And then counties also have a new process where when they have lost contact with the beneficiary because the returned mail doesn't have a forwarding address, they now have to make a contact out to the person that isn't mail, which makes sense if they can. So if they have the phone number, they have to call them. If they have an email address, they have to email them. So how should we be getting ready to receive these contacts? Well, report updated contact information. Number one important thing to do. Sign up for an account at benefitscal.com. Everybody who could do this should do it because it gives you another way to be receiving and completing information about your renewal. And you can go on to benefitscal.com and you can look up when your renewal is due. It'll take about 24 to 48 hours after you create an account for it to appear, but you can log back in later and it'll tell you what your renewal month is. And then the state also set up a new place, keepmedicalcoverage.org, where you can sign up to receive general information and alerts about the Medi-Cal renewal process. So that's another thing that's good to do. So on to some improvements in the eligibility and enrollment process. This is good because these are things that'll make the behind the scenes operations result in more people keeping their Medi-Cal. So it's good that we know about them so we can push to make sure they happen. The first is for automatic renewals. This is sometimes called ex parte. This happens when a county looks at all the information it already has in the file from the last renewal and any updated information that it has from basically anywhere else, including a lot of electronic data sources. If they can renew the file based on that information they have access to, they have to do it, and they will do it. It's normally about 30 to 40% of all people get this automatic renewal. There's really nothing you can do as a Medi-Cal beneficiary, unfortunately, to make sure you can go through the automatic renewal process. It only happens when the computer system and the data they have available allow them to automatically renew. The counties must do this for both MAGI, which is people under the age of 65, and non-MAGI, which is generally people 65 and older or people with disabilities. They have to do it for both groups of people who have Medi-Cal. But there's a big difference in how they do it. For people 65 and under in MAGI, it's automatic. For everybody else, it's manual. So you might see this not working as well for people who are 65 and up and people with disabilities, but you can still push for them to do it. There is a small issue, maybe not so small, but it is one, with people who don't have Social Security numbers or ITINs. They might not be able to auto-renew. So that impacts a particular group of people who have Medi-Cal, so you might count on them receiving renewal packets, because when a renewal is not automatically done, they are then sent the packet. Next here is an update on reasonable explanations. This is a new thing we can do during the Medi-Cal annual renewal process. When? Well, anytime that you have you're being asked to verify your income, how much money you earn, you can contact the county and explain what your income is by phone, in writing, in person, over the internet, however you want to do it. They allow you to do this because they are looking at the income they already have in your case file and comparing it to the information of the income they get from the electronic data sources. If those two things are different, you can contact them and explain why they are different. Here are some examples of things, if it applies to you, you'd be able to explain, like you lost your job, or your hours went down, or your income was only seasonal, or you got married or divorced, or you are homeless, or you don't file taxes or haven't filed taxes yet. There's a downloadable form that is optional that you can use to provide this reasonable explanation, but you can also not use the form and do it however you want. This is important to keep in mind anytime somebody is having to prove what their income is. Think, well, could they contact the county and explain one of these situations? If so, this is one thing that you'll want to help people be able to do. Here's an example. Rebecca submits her renewal with her Social Security income proof. The county reviews it, and the electronic data show that she has earned income from the YMCA. Here, the county reaches out to Rebecca, and they explain, and Rebecca has an opportunity then to explain that her YMCA income was temporary summer employment. It was only seasonal. That's a reasonable explanation. The county can stop, check the box, income verified, and continue with the renewal. They also have to help Rebecca with the rest of her renewal when they're on the phone with her to try to get it done right there. Next is they can do a very similar thing for assets. Some people who have Medi-Cal have to also, until January 2024, they have to show that they have assets below the limits. Starting in January 2024, the asset limits will go away. In the meantime, this program will help people, electronic verification of assets. Like with income, counties receive electronic data reports of assets. Counties must use those data to check the box, verify the assets when the assets they see in the case file plus the assets they see in the electronic report together are below the limit, which should happen almost all the time in the next few months when this is happening and the limits are in effect. So we think almost nobody will have to turn in paper proofs of assets because of this improvement. You'll want to watch out in your cases for clients who have assets that are well below the limits. They should pass automatically through this flexibility that the counties now have, and they also must use. There's an example here of Renato, who has a $1,500 checking account in his case file already. The county gets electronic reports showing no Wells Fargo account, but it shows a new $6,000 Chase checking account. All the county needs to do is add up those numbers and see it is well below the asset limit, not ask for anything else, check the box, assets verified. They cannot ask for verification of the Chase checking account or the Wells Fargo checking account. They have what they need and they can proceed with processing the renewal. Another tool to keep in mind is sworn statements, also known as affidavits. This allows people to, instead of providing a paper proof of something, verify whatever they need to verify, except for social security numbers and immigration or citizenship. But for everything else, if you don't have access to a proof, you can provide a sworn statement instead. You can do it by phone, mail, in person, or electronically. There is a technical requirement that counties only have to accept this as a last resort. What is a last resort? It depends on your situation. For example, you could be at the very end of the month and your Medi-Cal is about to terminate and you can't get to your former employer in time to get a letter. You can then provide a sworn statement of whatever that letter would have said. And this is something where you read something very specific that says you swear under penalty of perjury. The county uses it, checks the box, verifies it, and proceeds with processing the renewal. Here's an example of Rebecca. She is trying to auto-verify her assets, but after they do that, they're requesting proof of her YMCA income, employment end date, where they want to know when it ended so they don't have to count it anymore. This is something that often happens. Rebecca can't get proof of that from the YMCA. She just can't get over there in time. They're not open as much as they were during the summer. So she provides a sworn statement about what her end date was of her employment to the county by phone. They accept it and they should proceed with the renewal. Another thing to keep in mind is state fair hearings. This is something that can help people resolve an issue that is going wrong with their renewal, especially if they are way at the end of their renewal period. They're trying to turn things into the county, or they have turned something in and they haven't heard that it's been processed and they get their 10-day termination notice. They might want to request a state fair hearing. If they do that, it keeps their Medi-Cal on and active until the hearing happens. And it's a good way to resolve any kinds of issues that somebody might be having. You can request a hearing by mail, online, in person, fax, or phone. There's an extended deadline to do that during this whole period, pending federal approval. But right now it's 210 days total instead of 90. And also, the state has and the counties have longer to resolve the hearings, but it should not impact any kind of recoupment of Medi-Cal services, and Medi-Cal would stay active the entire time. I'm going to skip this example for time's sake. So another thing to keep in mind is after the Medi-Cal cutoff, the 90-day cure period, after Medi-Cal is terminated, people can turn in whatever they needed to turn in that they couldn't turn in within 90 days and get their Medi-Cal turned back on. Really important right. It's not a new application. It's simply what you couldn't turn in time before. So keep that in mind. It's a good one. All right, I'll turn it over to Alicia.
Great. Thank you, David. Hi, everyone. Thanks for joining us. I am going to be talking through some special scenarios that may help the clients and consumers you're assisting during the unwinding period. Next slide, please. Okay. So in November, CMS finalized a set of rules that streamlines and expands enrollment in Medicare. One positive change we wanted to highlight is that the rules make it so that coverage in Medicare will begin the month following enrollment. And so that means that there will no longer be a 2 to 3 month delay in enrollment. That's a good thing. Another thing we wanted to highlight is that the rules create a special enrollment period for people who lose Medi-Cal, and this will be really helpful to people who stayed on Medi-Cal beyond their initial Medicare enrollment period. It gives individuals 6 months to enroll in Medicare, and they can choose to enroll retroactively as far back as January 1st of this year, or they can start coverage the month following enrollment. The rule also creates a Medicare Part B special enrollment period to help consumers avoid what can be pretty hefty Part B penalties for late enrollment. Next slide, please. Okay, so really good news, the Department of Healthcare Services made a policy decision to keep continuous coverage for those turning 26 and aging out of the young adult expansion population. That means that during the unwinding, these individuals will stay on Medi-Cal until the 26 to 49-year-old Medi-Cal expansion for all individuals, regardless of immigration status, is implemented in January 2024. This helps people avoid a gap in coverage, so it's really good news. The 2 dates you see on the slide, the state has basically said they're setting 2 different renewal dates within this population. January 2024 will be the month of renewals for young adult age outs with a household member who is 65 or older or disabled, and February through May 2024 will be the renewal timeline for the rest of this population, and they will be spread out over time. And just because we received a couple of questions before the webinar about our undocumented population, I just wanted to address that generally renewals will happen for our undocumented population, just like for everyone else, with the exception of this slide I've presented. And please remember that individuals are entitled to receive assistance and notices in their preferred language. Next slide, please. And some of you may have already heard about SB 260. SB 260 will automatically transition individuals who are losing Medi-Cal, MCAP, and C-CHIP coverage and who are eligible for Covered California with financial assistance to Covered California coverage. So these individuals will automatically be enrolled into the lowest cost silver plan through the exchange, or the same plan they had with Medi-Cal, if that information is available to the exchange. Individuals have to opt in, or they can opt out and retain a 60-day special enrollment period to pick a different plan of their preference. The goal of this implementation is to avoid gaps in coverage, and since it's being implemented right when the unwinding starts, the hope is that it will seamlessly transition individuals to exchange coverage. Next slide, please. Great. So now we're going to transition to talking about how you all can take action today. So there are lots of things that are happening all at once. And first and foremost, we really appreciate all the work that you all are doing on the ground to help make sure that people stay on coverage. Please spread the word that people with Medi-Cal can and should report their updated contact information. As mentioned previously, that includes their phone number, their mailing address, their email address to the county welfare office. As David mentioned, they can report it through other channels like Covered California as well, but it's generally better to report to the county since, for example, with CalHears, updating information in that way still requires an additional manual step. Folks should also, if they don't already have an account, create a Benefits Cal account, and people can see their renewal month through Benefits Cal. That's a big positive. Additionally, folks, as mentioned before, can sign up for email and text message alerts at keepmedicalcoverage.org. And they should be encouraged to read the outreach mailer that has just or is arriving soon in their mailbox. If they didn't get one, that may be an indication that the county doesn't have their updated contact information. So even more reason to contact the county. Again, just for repetition, watch the mail and online alerts for information from the county. Check for renewal packets in that yellow envelope. Respond to all those requests, and if necessary, request a state fair hearing. Next slide, please. And then as advocates and assisters, what can you do? What you're doing already is really the biggest thing, helping people take action, and taking all of those steps mentioned on the previous slide is a huge help. And we note that individuals with limited English proficiency may need additional help to contact their county worker or fill out forms if it's not sent to them in the correct language. And people with disabilities may need accommodations or assistance to get information from the county. You as advocates, assisters, clinic, hospital staff, you can all sign up for the alerts through keepmedicalcoverage.org. And you can, if you haven't already, sign up to be a coverage ambassador. This will get you the latest state resources and updates. And then we just really encourage you, and we've gotten a couple questions already today in advance of the webinar about outreach materials. So we encourage you to share widely the outreach materials that the department has developed. Share them in your clinics, in your hospitals, at your legal aid offices, in your schools, in your churches, and every other place where we know Medi-Cal beneficiaries will see the information they need to stay on coverage. There is a new DHCS outreach toolkit in both English and Spanish, and the toolkit includes social media graphics, call script language, printable flyers and postcards, even draft emails that can be used. The phase 2 of the outreach campaign by the department, it focuses on kind of this renew it or lose it language, and it's time to renew, things that will hopefully catch the attention of Medi-Cal beneficiaries. And then, lastly, helping people to renew their information, requesting a state fair hearing if they need it, and remembering that There's also the protection of a 90-day reconsideration period after Medi-Cal ends to restore coverage. Next slide, please. This slide, we're just reminding you once more about Medi-Cal renewal rights that are critical to just be mindful of. Watch out for scenarios where people can't get through to their county call centers. Unfortunately, we're already hearing about really long wait times, but this is information that you want to lift up to us. We would like to hear about it. Also, watch out for if someone you're working with submits their renewal information, but their Medi-Cal coverage still terminates. Something might be going amiss. Or watch out for if the county does not accept the beneficiary's reasonable explanation or their sworn statement. And also if the county asks for asset proofs. We also want to lift up the toll-free number for the Health Consumer Alliance, which is a statewide consortium of legal aid organizations that can provide free legal assistance on healthcare issues. So the phone number as well as the HCA website is listed on this slide. You can check out our resources, which we'll discuss a bit more in our resources sections. Next slide, please. Great. Finally, we just wanted to discuss some available resources. There certainly are a lot out there, but we're just lifting up a couple of the highlights. Again, Health Consumer Alliance phone numbers are available there for you. The HCA is available in all California counties for beneficiaries that need assistance. And then please, through the HCA, visit our Keep Your Coverage website. That is a landing page where we will be continuously adding to the critical resources you all will need, with hyperlinks and everything from the state policy guidance, toolkit links, etc. So feel free to use that as kind of a one-stop shop. And we also wanted to lift up NHELP's Public Health Emergency and Medicaid Continuous Coverage Unwinding landing page. I know that's a mouthful, but we're just lifting up here two of the resources that we have. One is a comprehensive list of guidance and toolkits, and the other one is a due process checklist that we've developed. It's not California specific, but certainly useful for the process that should unfold with the unwinding. Next slide, please. And then here are just some additional resources. I won't walk through these now because we do want to leave enough time for questions, and I'm noting the time right now, but take a peek through those when you have time. And here we are at questions. I know many of you have been asking questions during today's presentation. First, just a repeat one that's been coming up again. Everyone will receive the slides. Everyone who registered will receive the slides after today's webinar. So you will have that. Let's see. Another question that was coming up a lot had to do with opportunities for funding, whether CBOs could help with renewals, those sort of questions. And I will say that at this juncture, there is, the DHCS navigator funding. There are navigators who are helping people to stay on coverage, but I am not aware of any other additional funding at this time that is available for these efforts. I'm going to pause for a moment to see if one of my colleagues who's been monitoring the chat during this last section wants to lift up a question and answer.
Yeah, thanks. There's a good one here about the renewal process for foster care children and former foster youth, people who have continuous Medi-Cal coverage. Yeah, we didn't talk about that, but yeah, people who have continuous Medi-Cal coverage who don't renew normally annually, this does not change any of those rules. So those people can still be covered and they wouldn't be part of this if they do not normally annually renew. And then related question about where do renewal packets go for youth or adults who are experiencing homelessness? It depends on the county and what address, if anybody has an address attached to their Medi-Cal case file. People might include the address to receive their mail at their local Medi-Cal county office. They might receive it somewhere else. If they have that, it will be sent by that to that address. A good thing for anybody to do, especially people who don't have consistent access to mail or an address, is to sign up on benefitscal.com. That is really the best way to make sure no matter where you are, if you have access to that website, you can get the information and submit your renewal.
Thanks, David. Yeah, and I also just wanted to note the comment about the long wait times for like Riverside County, and just want to thank you for sharing that. I think that's something that we are concerned about. We heard about in some counties, people trying to call in and having long wait times. Our recommendation is to call the Health Consumer Alliance if folks are having issues getting through, or you can contact us. We're trying to elevate cases and make sure, because they're always asking us for case examples when we point it out. So the more examples we actually have, the more we can kind of show, like, look, people are trying to update their information, and they're having issues getting through. But that is something that we are concerned about and trying to monitor. And Alicia, oh, sorry, I was just going to point out a question that came in related to the undocumented population. What will happen to the undocumented who are over the FPL for Medi-Cal? I'm assuming during the unwinding period.
Yeah, so we would need more, if they're over income, then just like everyone else, they will go through the renewal process. If they're no longer eligible, then they will lose Medi-Cal coverage. I know that there are some efforts from some of our partners who may be on today's webinar to legislatively and otherwise try to expand coverage options for our undocumented population. But that's kind of the scenario that we will see. I wanted to lift up, there were quite a few questions, some which we answered through Q&A, some that we received before, about figuring out people's renewal month and how FQHCs or other assisters can help people figure that out. As we mentioned in the presentation, but also it's certainly worth repeating that, you can help the person call the county to figure that out. If wait times are exorbitantly long, they can also get that information online at Benefits-Cal if they establish an account. So that's another reason we're encouraging it. So wanted to lift that up.
Great. And then let's see, David, I'm not sure if you have updates on this, but will Benefits-Cal grant access to counselors to access cases without the client's login? I thought that was maybe a no, but just want to confirm if you have a different understanding.
I don't. Sorry. There is functionality in Benefits-Cal for community-based organizations to sign up to be assisters, to get basic information to help people with their renewals, and that's what people are doing now.
And then one just came in again about our undocumented population. So I want to clarify that right now in California, if people are otherwise eligible for Medi-Cal, California covers undocumented individuals up to the age of 26, as well as our 50+ population. So we just have one remaining gap. That's the 26 to 49-year-old population I mentioned in the slides. That will be implemented January 1, 2024. So yes, if folks are otherwise eligible for Medi-Cal, undocumented can apply for Medi-Cal.
There's a question in here about the affidavit, also known as the sworn statement, trying to get the county to accept this. Forgot to mention in my section, these changes about accepting sworn statements by phone are new. So it's something that counties are learning and getting used to. So when they are not accepting a sworn statement, we might have to remind them to do that. They also should be accepting the report of the information if it's a change in circumstance in all the ways they've normally done it, and not requiring anything written. They may ask somebody to confirm that it's true in one way or another, but it should be all done over the phone. So if you're encountering any troubles, please let us know and we can try to help. There's a question in here that I don't know the answer to. I'll raise it anyway to see if anybody does. Will regional center consumers with DD waivers for Medi-Cal be affected by the renewal restart? My preliminary thinking is for somebody who has SSI, they are not subject to everything we just talked about. They keep their SSI, redetermine their SSI, however SSI does it, and their Medi-Cal comes along. But for people who do not have SSI and they have some other kind of Medi-Cal, they would be subject to everything we just talked about. I don't know if anybody knows anything else about that.
Yeah, I don't either. My understanding is just, yeah, if they have Medi-Cal that is linked through a benefit that they're getting, like that's how they have Medi-Cal, is through that benefit, then as long as they qualify, still their Medi-Cal shouldn't be impacted. I can try to look more into that one. And then I see a lot of questions about the FPL limit and if we're advocating for changes to that, if those will change in the future. I mean, the quick answer is, I mean, yeah, the limits don't account for the realities of, you know, what it costs to be in California, at least. And they do change each year. They don't always change significantly, but they do change each year. And we try to update those limits each year so that the consumer community and other advocates have that information. But yeah, it's a difficult thing to change because it's across the board federally.
Yeah, I would say if you want to improve those, hey, so do I. We should be talking to our legislators who have the power to do it. There's a question here about people who have Magi Medi-Cal, which are people under the age of 65, being asked to turn in verifications of their property. No, that shouldn't happen. People under the age of 65 who have Magi-based Medi-Cal do not have any requirements around property. So if that's happening, that's an error. It's possible the county is trying to evaluate them for the other type of Medi-Cal where there is currently an asset limit. But if that's not what should be happening in your case, that's something definitely to escalate to the county to get them to process properly. You can let us know. We can try to help with the connection to the county to get that solved. There is a question here about how long it takes the county to process a renewal that's submitted online. It depends from what we've heard, but what we have heard from counties is that they like it when people do it online. And that's because it's all already in the computer system and it helps to get into their computer system a lot better and faster for them. So that's one advantage. Another advantage of doing it online is as soon as you submit your renewal on Benefits-Cal, if it's before your Medi-Cal ends, that keeps your Medi-Cal on until they have a chance to process it. So there's a big advantage there. It almost wouldn't matter how long it takes them to process it, as long as you get it in before your Medi-Cal would otherwise terminate. They should keep it on until they process it.
I see a question about some clients who don't receive their packets, but in Benefits-Cal, those like notification wise, the reason I don't understand the question. I'm not sure if whoever asked could clarify it.
I think it might just be talking about discrepancies, like when people are getting information or contact from the county through their online portal, but not getting the paperwork in the mail. And again, it's been a very long time since the counties have performed these redetermination processes, and it's very possible that there are hiccups. And also a lot of people have changed addresses. So it could be that they just don't have the person's updated mailing address. And that's why we really want to stress that it's of utmost importance right now, before the unwinding starts happening, that people get their updated mailing, email, and phone number to their county welfare office.
The law that passed that those who do not qualify for Medi-Cal will be sent to cover California. So that was SB, well, there's SB 260, which we discussed, which is going to do the auto transfer. So yeah, at SB 260.
There's a question. Oh, go ahead.
I was going to say this ability to pay Medi-Cal benefits. I don't know the answer to, but I am poking around to see if I can pull up an answer here.
I saw the one about does applying for Medi-Cal affect immigration process or status? No. Generally, Medi-Cal not counted in anything having to do with immigration that people are understandably worried about, including public charge. Medi-Cal is not one of the benefits that is counted. The only time there's a rare exception where if somebody is institutionalized, put in a nursing home, for example, for a long-term period, that might be one factor that could be considered. But regular old Medi-Cal for almost everybody, not a concern for immigration status.
Question about TV ads for folks about the importance of updating contact info. Yeah, we've received some information that yeah, the state, their communication campaign is going to put out TV ads, and I believe in other languages as well. We don't have all the specifics, but yes, they are going to be putting out TV ads, digital ads, and then physical ads out in areas that get high traffic, kind of everyday life, areas like grocery stores and things like that.
Yep, they're already on some bus stops. You should be seeing some messaging out in your communities. And they will also be, the department's contractor is also working with some radio stations.
See a comment here about how benefitscal.com requires somebody to have an email address to sign up. That is unfortunately the limitation today on benefitscal.com to have an email address. People, if they are able to sign up for any kind of email address, that's what they should do. We are pushing for BenefitsCal to provide other ways for people to sign up soon, so stay tuned. I just want to note in the chat, somebody chimed in helpfully about that situation of somebody who has Magi Medi-Cal, so under age 65, why they're being asked to prove their assets. They included some helpful information. The county might be trying to process them for non-Magi Medi-Cal. They also might be trying to see if an asset is producing income that counts for that person's Medi-Cal. So that might be a reason why it maybe isn't a no, that shouldn't happen. In those situations, it could happen.
And I just responded to the ability to pay comment. I'm having trouble finding exactly what that is. So I put my email in the chat if you can reach out directly with maybe some more information about the situation you're asking about. We can try to look further into it.
Yeah, and I'm seeing Lynette's comment and question related to BenefitsCal. And it sounds like there's some extra onus that's being put on enrollment assisters, advocates, and beneficiaries, that even when the renewal is submitted, DPSS is saying that they have to call to report it was submitted online, otherwise it won't be checked. Doesn't sound great. That is the sort of thing that certainly we want to be lifting up now and during the unwinding back to the state. So Lynette and everyone else in the next slide, we also have our emails, but this is something we can lift back up to DHCS. So to answer your question, if there's something new in place that lets the worker know that the docs were submitted, not that I'm aware of, but again, I don't think that there should be these additional required steps. So thank you for alerting us.
There's questions here about putting stuff into BenefitsCal and having to maybe contact the county some other way to let them know that you put something in BenefitsCal, you uploaded something or sent something. It's not supposed to require a second step of calling the county. Whenever something is submitted in BenefitsCal, the county gets an alert or it gets the item directly from BenefitsCal and then works on it. If you're having to contact the county afterwards to get them to find whatever you submitted on BenefitsCal, please let us know. We can work with you and with the county to investigate where the hiccup might be and try to resolve it.
The COVID-19 Insured Group Program is ending May 31st.
And I will add, this is just my plug, my plea, that if you still are coming across people who have any medical debt related to COVID testing or treatment in the last almost 3 years, that you can still have them apply now and get that covered retroactively. So please spread the word.
Now a good time maybe to wrap up and let people know that all the questions that we got to and that we are not able to get to because it's 3:15, we are keeping our website updated. It's at healthconsumer.org, appearing on this slide. You can go there and navigate to our COVID page. Down at the bottom are tools for advocates and assisters. You can check that out, and we're adding to it almost daily.
All right. Thank you so much for joining. And yes, please reach out to us if you have any other questions. And yeah, we appreciate you attending. We will circulate the recording and the slides after this presentation, probably in the next day or two. Thanks so much, everybody.
Thank you.
Take care.